What is involved in your recovery as far as follow-ups? So after your surgery, there is a follow-up at the 1 week mark and also at the 2 week mark with our nursing staff. Now, during either of those follow-up appointments, I will also see you to see how you're progressing. Now, generally, the first primary phase of recovery is considered to be the first 6 weeks after surgery. Now, at this stage, most of your swelling will be gone, most of your bruising should be gone, and from 6 weeks on, you should be able to resume all normal activities, as far as even going to the gym and doing any sort of physical exercise. Now, if required, we also do a 6 months follow-up. Now, as far as your swelling is concerned, now some people will swell up to about 1 week post-operatively, some people live 2 weeks, some people even a little bit beyond that. Everyone's body is different. How they recover from surgery is also very different. And as far as your final long-term results, that is completed when the skin contraction you get from vaser liposuction is complete, and that can take up to 6 months. So realistically, 6 months to achieve your final best possible results from vaser liposuction procedures. So what is involved in the aftercare after liposuction surgery? So the first and most important thing is wearing your compression garments. So for the body, my protocol is 6 weeks full time. That's 23 hours a day, every day, for 42 days straight. Now you take it off for 1 hour a day, and that's the time which you shower, you obviously wash your garments, and you do your lymphatic drainage massage. Now, as far as lymphatic drainage massage is concerned, that is another very, very important part of your recovery in order to get the best possible results. I normally get my patients to start their first lymphatic drainage massage 3 days after their liposuction surgery, and then to continue daily right until the end of 6 weeks. Now, this can be a combination of professionals and also maybe family members, someone at home that could help you with it. But the key importance is the daily nature of it. So after vaser liposuction to your lower face or the neck, the compression garment, that needs to be worn for 1 week full time. That's 23 hours a day for 7 days straight. And after that, I ask my patients to wear it for part-time for 2 weeks. Now that part-time, what that means is it's at least 12 hours a day, but essentially more the better. So for most people that have a 9-to-5 job, I tell them you take it off when you're getting out of your car when you get to work, and put it straight back on when you get back in your car after work. And on weekends, or if you have a random day off during the week, I'd rather you keep it on unless you have to go outside for something. Now, same thing as far as the lymphatic massages are concerned. You start day 3 and continue all the way till the end of week 6. I find most patients who do the facial and neck area for liposuction, after the first couple professional ones, most patients can do it themselves. They have good access, and it's a very comfortable area to actually massage the areas yourself. Okay, so how long should you take off work after getting liposuction or fat transfer surgeries? So generally speaking, most areas of liposuction surgeries on the body, if you have a sedentary job, I would recommend 1 week off work minimum. If you're getting extensive areas of your body treated with vaser liposuction, ideally 2 weeks. If you have a very physically rigorous job, such as construction or you're an athlete, I would take a lot longer. The general trend of recovery is after 6 weeks, physically you're able to do anything. So we have to tailor your return to work in coordination with what's required of you at your place of work. Now, for fat transfer specific to the glutes or BBLs, now obviously you can't sit on your bottom for 6 weeks. So people that have a sedentary job, I generally say you can go back to work at 2 weeks, but this is provided you have a stand-up desk or you can kneel on the ground. Really, that's something you have to be able to adjust and be able to work with your recovery to make it a feasible option. Now, people that have a very physical job after fat transfer to the buttocks or BBL, I do advise them to take 6 weeks off work, because another part of the recovery in a fat transfer surgery is not to move your body too strenuously during the first 6 weeks of recovery. So once again, if you're in a line of work where you require a lot of physical activity, I would advise those patients undergoing Brazilian butt lifts to take 6 weeks off work. A common myth about liposuction is that after liposuction, if you were to gain weight, that fat somehow miraculously goes elsewhere. Now, this is very far from the truth. What is happening is when you're gaining weight, because you're essentially in a calorie surplus, the fat cells that you have and wherever they may be located, they're just getting bigger. So after liposuction, the certain areas that we targeted, those areas are significantly depleted of fat cells. What that means is with a certain amount of weight gain, yes, those existing few fat cells will enlarge, but you're not going to see a huge difference in overall volumetric difference. So other areas are going to get big as if they would have, even if you hadn't had liposuction. But relative to before, where you had other areas of which were of more important concern or more obvious sort of protuberance and size, the other areas that you didn't have liposuction can appear bigger when you're gaining weight. But it does not mean that those areas are now bigger than if you hadn't had liposuction to begin with.